So with that, it's really my pleasure to introduce our keynote speaker, Ron Sims. I've known Ron, I don't know how many years, probably over a decade. He's sort of a hero to me because he was the key leader behind starting a coalition in Washington State when he was King County executive, probably the best known county in all of the country, incorporating the Seattle region. And as King County executive, Ron had the vision of starting a coalition that would have all the major stakeholders around the table, again, to drive the agenda of improving healthcare and lowering costs. And it was Ron who really organized the coalition, and he tells the stories of how he called all the CEOs of the major healthcare groups and the major employers and basically said, you will be at this table. And this is such a critical initiative for our community, and we need the engagement of leadership to make it happen. Ron from King County went on to become, under the Obama administration, the Deputy Director for the United States Department of Housing and Urban Development, where he had his stint in Washington, D.C., and then went back to Washington. He is now the current board chair of the Washington Health Plan Finder, Washington State's insurance exchange, and I might add, one of the more successful insurance exchanges in the entire country. You have in your materials his full bio, but without further ado, I'd like to introduce my friend, colleague, and inspiration, Ron Sims. Ron?
Andy was very generous, and so now he said good things about me. I'll go sit down. It is a pleasure, a really true pleasure being here. And let me kind of give you some background about why I actually wanted to come. When I was in college, I remember it was a wonderful period for me. One is that everybody was surprised I got there. I actually could grow a fro, which I had at the time. I could wait another 100 years and never grow back. But it was a wonderful time of questioning and search. But I decided that I was going to show my mom and dad that I had a degree of independence. My father went to Lincoln University in Philadelphia because Princeton didn't allow African Americans admission. So they sent them to Lincoln University. So my father was a scholar, teased us in French all the time, and we developed new French phrases in the household. And then he went to Latin, which he also enjoyed talking to us in, and I had no desire to speak Latin. He was a master organist, a brilliant writer. He read really thick books. I taunted him with my Superman books. I decided that I was going to get a psychology major because my father had a sociology major. This is my way of protesting. And then I realized as I was acquiring the major that all of us are a little crazy, and so I didn't want a career where I would be sitting talking to people and realizing how many of those behaviors I manifested in myself. So then I decided I would have a sociology minor as a way of continuing the tradition of my father and my brothers. And then, but my best class, and the major I really wanted that I took more credits in, was anthropology. Because on our campus, that were the crazy professors. They challenged the norms. They asked us to think outside the box. And the one thing that I learned in anthropology was the power of the transmission of ideas. You cannot look at culture and not realize that One place would get an idea, whether it was pottery, whether it was jewelry, whether it was clothing, whether it was hunting, whether it was weapons, and then you would see its migration to other places. It may be a quick migration or a longer migration, but nonetheless, human beings, for whatever reasons, we like other people's ideas so that we can claim them as our own, and then they will mature them, and somebody else will take them. So I am coming here because we have no idea what Maine means to the rest of the country. Because you are the cauldron of incredible ideas on healthcare. And I remember saying, Maine wants me? Oh, I am going to steal as many of the things that you are doing. Go back to the state of Washington and people will think, oh, look at Ron, he's really, really great. Look what he's doing. I want to go. And I will have to confess to them. I'll say, well, it's being done in Maine. You are so incredibly special. You are doing out-of-the-box thinking. You are so well organized. It's like coming to a pilgrimage and finally showing up to where it's all being done. So I want to thank you for your incredible work, how you're organized and the issues you're taking on. In healthcare, people always would say to me, how did you get into healthcare? How did it happen? And I always tell people there were two instances that actually provided me an early acquaintance to healthcare. When I was a kid, you had to drive from Spokane back to New York every 3 years. So my father would see his parents and I could see my cousins, but you couldn't stop because there was no such thing as being able to accommodate people in restaurants. You would go to a gas station, so you packed all your food, you got in the car and you drove until you got to Minnesota. And then at Minnesota, you got to stop at a restaurant and eat. And so I remember I grew up in the era of choo-choo trains. Choo-choo trains, you know, they were choo-choo trains. You know, steam, smoke, a lot of noise. And the first time I saw a diesel train, I was in North Dakota. And I remember seeing this train moving as fast as our car, but there was no smoke, there was no steam, there was no wheels turning, it was just gliding. And I decided to get a closer look, so I opened the door of the car. I remember the feeling of bouncing off the back of the rear tire, and then I hit this road. I looked up and I saw my parents' car up in front of me, so I got up and started running after the car. I did not want to be left alone in North Dakota. So I was running up the freeway, and finally, my father always says, he was telling my mother says, I think that's Ronnie running up the I was badly cut up all over. We were turned down at every doctor we went to, who finally sent us to a hospital run by nuns, who brought us into the rear door, and I have pictures of me totally bandaged up. That's called the absence of health care, when you are denied it. Denied health care has consequences. But also at an early age, I remember my parents going shopping and my oldest brother collapsing. And I remember he had asthma. And I remember my parents always said, call 0 and ask for an ambulance. An ambulance came, and they took my brother. My parents came back and said to us, your brother is not going to be living with us anymore. He had a doctor named Dr. Steer in Spokane. And Dr. Steer made a decision to call the National Jewish Hospital in Denver, Colorado, that specialized in young people like my brother. And my brother would spend 5 years in Denver, Colorado, getting medical care that would change his life and give him 53 more years of being my big brother. That's what happens when you have health care and it's responsive to individuals and families. So I have always said that when I look at health care, I have a feeling of what it's like to have an absence, and then have health care in your life when it actually materially makes a profound difference and molds and shape you. So when you talk about healthcare, it's not an issue of intellectual discussion or what we call a delivery system. To me, it has life consequences, and we should understand what those consequences are. When I was King County Executive, I had the time of my life. I loved it. One is I've always grown up realizing that, rather than try to be smart, let other people be smart and take credit. So I did. And the idea was to hire people and say to them, and I had a rule. I said, if you take a risk and you succeed, I'll sing your praises to the end of the world. If you take a risk and you fail, I will applaud you to the end of the world. But if you take no risk at all, I'll make it the most miserable work experience you've ever had. Because human beings are dynamic, and we're a dynamic society, and we've got to step up and tackle those issues that we look at and say, they're too hard. So I was very, very lucky. I had people who would say to me, well, we're going to do this. And I would say, okay, fine. Then I would say, it's going to hurt. But then the last sometimes it did. But on healthcare, I got into it in an odd way. As we were going through the battle of having our healthcare costs grow and figuring out how to pay it within our budget. And I remember 95% of our employees were in unions. And I remember saying to myself, I'm going to have to bargain with the unions on premium share. Premium share. Now, I also had a program at that time when we had fellows. And the fellows, we would get them out of universities, and our job was for them to think outside of our culture in King County government, to be able to bring new ideas and to argue. So I remember saying in a meeting with all of our budget staff and senior staff that we would move forward on premium share. And a young man named Jim Lopez got up and said, that's a bad decision. Now, I didn't take any, my kids been telling me that for years, so that when Jim said it, I just said, well, I'm kind of used to this. My wife says it too. So I said, okay, fine. So I said, but the rule was if you wanted to challenge me publicly in a meeting, you had to come back with a new idea in 2 weeks. Now, I never held to that rule, but it was just kind of to say, don't say I'm wrong without giving me an alternative. So Jim Lopez did. He said, why? He says, no, premium care doesn't work because it never alters, ever alters the cost of use, ever. Premium share does not cut down people's use. Never has and never will. And I said, okay. He said, why don't we ask, and he had a list of people in our area who go all over the world to do consultations on healthcare. He said, why don't we bring them together and ask them what they would do? And I said, okay, but what do I want to tell them? He said, why don't we ask them, can you make insurance pay for wellness? And I went, okay. I don't know what that means, Jim, but I'll go do that. So we sent the letters out. I expected 2 or 3, and we got all 22. And then they didn't even talk to me because they had never talked to each other. So the first meeting, they were just talking to each other. And I was sitting there thinking, can I regain control? So I said, can I get you back? And we did. So we got this group of people who consult all over the world. We got them every 2 weeks for 6 months. And we came out with a plan where we altered the shape of the insurance we provided. We went to our employees and said, we're not going to do premium share, but we'll have a new system. We're going to have co-pay incentives and disincentives. So we're going to have what we call a gold standard, and we're going to have a silver standard, and we're going to have a bronze standard. If you do nothing in terms of our approach to wellness, you will have a bronze medal and a huge copay at time of use. I mean, a really disincentive copay at time of use. He said if you take the test, because we wanted them to take a test, then you will get a silver medal, just for taking the test. Now, I described the test as thorough. My wife said the test was invasive. However you wish to look at it, you had to take a test. And both adults in the household, no matter what your relationship were, had to take it, because adults influence adults. And then, if you were like my wife, who could proudly say, I only have to keep a diary of my exercise regimen. What do you have to do? I said, I have to go to 7'2" to be not morbidly obese. She says, you're going to be coached, yeah. So I didn't mind it. And in fact, it was a very good decision and a reminder of what my health status was. 90% of our employees participated in it, and it still endures today. Because we empowered people to make wellness decisions. So we have less use, right now, and it's documented, King County saves between $25 and $42 million per year in its health care costs on wellness issues. And the debate is only upon, can we take credit for the employees that go to another employer, but we can still look at their data and say they're not using healthcare system. They're smart because they're well. For African Americans in particular, there was a study done which showed that on diabetes issues, they had the lowest rate of diabetes, and on top of that, they had the best results for the management of the diabetes. And people said, why? We said, because we didn't tell people who had diabetes that they were sick. He said, there's ways that you can actually organize yourself, which they did, in the support groups. That's what people do in AA and other groups. Talk to each other, because diabetics tend to believe that they're the only diabetic on the planet. And that when they're sick, they're the only person sick from diabetes on the planet. So we say get into a group where other people could encourage you to be disciplined on exercise and your medications and the food you eat. Share your experiences, talk them through. If you're going to be angry in a group that understands that anger. But the result was in the medical journal, this incredible series of outcomes that were unheard of with people who had diabetes. So that's how I got into the healthcare. I remember just saying, it was looking at a budget and saying to myself, colleagues, I can't afford the cost of healthcare. On the other side, though, Jim Lopez said, okay, we've got to figure out how to get healthcare industry itself to transform itself. I remember saying to myself, I'm not worried about that. But then again, Jim was being persistent, and I'd rather have him tell me this in quiet than to make a public broadcast. So I got on the phone. I actually went out and visited all these CEOs. And I said to the CEOs that I had a lesson for my kids. My kids, I had 3 sons. And 3 sons would do what 3 sons do. Some would sometimes resolve their disagreements by pushing and yelling. So I had a rule in our house. I'd walk downstairs and I would say, gentlemen, blood don't fight. That was what my father would say. So they would quiet down. When I got to be county executive, I simply said that we needed to have adult discussion. So what I did is I went out to every employer and I said to all the major ones, you have a problem. Mine are with taxpayers and yours are with stock shareholders. And the real issue is, can we afford the cost of health care? And what I want you to do is join a coalition so that we can sit down with the people who provide our health care and the plans and have an adult discussion on what we needed to do. And that's how the Alliance was founded, an adult discussion. Now, I could tell you the first meeting was an adult discussion, and it was adults acting as children. The second meeting was much better. Because all of a sudden people realized that we were not to sit across the room and yell at anybody. Our issue was to understand the complexities of healthcare, to appreciate that there was no free lunches, that we were not having any goals of saying who was bad and who was good. The idea was to create discourse, hire staff, and move forward with a series of plans that we thought would improve the healthcare quality. We said, I said to them, every doctor has a way of wanting to do a treatment. Is there a normative here? And the issue is, what are accepted practices? So we said, okay, can we apply those on a range of illnesses and treatments? And can we do the same thing with hospitals? And everybody conceded we could. So we said, okay, can we rate them? And everybody said, whoa, everyone was talking about how difficult it is to rate these. And we said, when we had a statistician who said, no, we can take the normative ones and back out any aberrations. It could be a person's unique characteristics. And so today, we continue to rate every hospital and every doctor in our area based upon practice. Are they doing what they're supposed to do when you walk in? If you have a heart attack, some people don't need statins, but most people do. Did you or did you not provide a statin? When you go to a hospital, are you coming out healthier or you're coming out sicker? And the issue is, how do you control hospital-acquired infections and diseases? It was all of this that was put into place. So the Washington Health Alliance was really now called Washington Health Alliance, started in Puget Sound because people said, okay, that's where all the crazy people are. Now it's statewide and covers everyone because people realize that you need to reshape practice. It also allowed us to do things that we hadn't done before, and that was Lower back pain. As I get older, I get more of it. And as I get grandchildren, I get a lot more of it because I don't want everybody to think that I'm weak, so I hold them even when they're heavy. And so sometimes, but anyway, lower back pain. So we went to a treatment issue. We had, everybody in our area had imaging on lower back pain. But imaging is immaterial unless you fall off a building. That's 10 stories high, but everybody had imaging. The second is that we had an inclination for surgery. So we said, wow, those are costly measures. So can we make a decision to readjust our approaches? Which is what we did. We said to them, no more imaging unless a person falls off top of a house or top of one of our skyscrapers or is in a catastrophic incident where we actually need to look at whether or not they have a need, whether anything is broken. The second is, we said, we want 5 weeks that the person has to be under before they're in surgery. And what we want them to do is go to Pilates, yoga, acupuncture, hypnosis, just do anything but surgery. Most of the people that now go through that system are never ever going to go through surgery. And most of them never completed the 5 weeks of Pilates and yoga and acupuncture and hypnosis. The issue was to work collaboratively on that process as a new practice. So when I look at the Maine Health Management Coalition, I look and I say, wow, you all were way out there doing it before we did because we stole a lot of what you were doing. We saw what you were doing and said, why don't we just take it? We don't have to be inventive here. And we could always tell people, they're doing it in Maine. They're doing it in Maine. You have no idea how powerful that is. And people know when I give speeches, I say they're doing it in Maine. They're doing it in Maine. And the idea is that Maine's doing it. Washington State doesn't want to be second to anyone, so it allows us to try to catch up with you and figure out new ways of getting ahead of Maine. But you guys keep working so fast. Please continue. So when I went back to the other aspect we had on healthcare is that I went back to Washington, D.C. where they were giving to an event. And my sons and my family were there. So I told my sons, I said, there's going to be a study coming out today. I want you to go to the press conference they're having and bring back all the paper but no duplicates of it. So my son said, how do you know, Dad, there's going to be paper? I said, it's Washington, D.C. It's a press conference. They have all the paper they have. And he did. And it was done by the Joint Center, which is an African-American think tank. And this think tank, what they said was that African-American males, that 36% of African-American males in the United States under the age of 30 would have nothing in common with the rest of America except their eventual death. So I remember getting that report, and my kid would say, whoa, Dad, I mean, this is really heavy. And this is inner city stuff. I said, well, I don't know. So I took it back to a young man named Chandler Fell in my office and says, Chandler, can you read this report? Because I need to address these issues. What is happening in King County? But Chandler is a demographer. He has the richest, most beautiful voice on the planet. But if you look at me, but Chandler's just Chandler. And I kept going back to Chandler saying, Chandler, what do you know? What do you know? I'll get to you. I'll get to you. But Chandler always got to me. But he did. It took Chandler 14 months to get back to me. He had assembled a group. And the group came out with a report that said that zip codes, we can look at a zip code and look at your morbidity rates by zip code and they differentiate by zip code, how you're treated within certain zip codes, the lifetime earnings of children in zip codes, crime rates by zip code. People say, what's the difference between poor and rich? He says, no, demographically, looking at the same numbers, it's not true. We can look at African Americans, single head of households, certain rates of poverty in this zip code, put them in another zip code and have completely different results. That zip codes, in fact, life determinants. PBS came back and took our model, applied it to Medicine, California, and found the same thing. So when I went back to Washington, D.C., what we said to everybody is that zip codes had to become an address and never again a life determinant. Now I can tell you that zip codes have a dramatic impact, and when you're looking at health policy, you see a light years difference between zip codes. Some actually flourish very well. People say, well, what is the difference? I'll give you an example of a difference. There was a recent article in Seattle coming out where who had trees? Who had tree coverage? Pretty basic. What neighborhoods had a lot of trees? So they mapped all these neighborhoods and said, here's the neighborhood with all the trees. But those are also neighborhoods that had the best health outcomes, whether they were poor or wealthy. Then there were neighborhoods that did not have a lot of trees. And people said, what do trees do? Trees, for whatever reason, also indicate parks, because we build parks in areas that are treed. We have community gardens and places where we have a lot of trees. We have wider sidewalks, slower traffic, and often paths. So we said that a treed environment brought out and spilled so much else that all of a sudden we were having healthy outcomes in those neighborhoods because we had people walking and feeling safe. We had community gardens, which are nothing other than places for people to gather and see who is in the neighborhood and who isn't in the neighborhood, to watch mischief, be able to share, to get to know everybody. It was a health determinant. So when I look at healthcare today, I keep saying we have our plans, we have our practices, but it's devoid of being able to look at how the built environment impacts. We're making a big mistake, because you can have all the great plans in the world and all the great policy in the world, but if people are in neighborhoods with signal to them through epigenetic factors that they should be stressed, we will never alter their health outcomes. We have to look at the wholeness of what it means to be healthy in this country. Fortunately, in Maine, you can do that because you have environments where you haven't decimated them yet. So you still have your trees in your rural environments. You still have trees in a lot of these beautiful homes. You still have places that are workable and definable and can teach lessons. I can remember when the Justice Department came to my office and said, we heard one of your speeches and we did a study, and you're right. We can tell you what a crime rate's going to be by the nature of what the neighborhood looks like. But it's really interesting because neighborhoods with parks, wider sidewalks, gardens, trees, they had really low crime rates no matter what the demographic was. But neighborhoods that had tall buildings and they were in concrete had really bad ones. I mean, the crime rate differed by 70% across all groups. And they said, why? I said, oh, we evolved in grasslands, not in canyons. They said, well, no, we can't say that as a part of national policy. So, nonetheless, we know by epigenetic factors today, the signals it sends out, children in environments where they walk to school and feel safe are better learners in school because they have less cortisol than environments where kids feel stressed and not safe. And you can talk about a street being safe, but it's not the street that's safe. It is the greenways that are safe. It is the parks that are safe. It is being away from traffic. So when we talk about healthcare, I want to make sure you understand the wholeness of it. But what you do in healthcare here is extraordinary. And I need to tell all of you that. I just need to say, you know, we won a Super Bowl last year. Go Hawks! Well, you know, everybody makes a mistake. Everybody understands an opponent every now and then. But on our way to our second Super Bowl, but last year, we won the Super Bowl. You are the Super Bowl winner in healthcare. You have that title. And the issue is with people who have the title of doing what you do, what you think is rather casual and easy. You are working on transparency of price issues. Transparency of price. I can shop for anything. Raisins, shoes, books, records. I can go on the internet. I can decide whether I'm going to do Amazon.com or somebody else is providing it. I can shop and know the cost and quality of what I am going to buy. That's exactly what you're enabling in Maine. The biggest battle we have in our area are people who want to keep that secret. And I want to go, why would you keep my choice, my ability to empower myself, secret? I should know whether the doctor is good or bad. I should know how they rate relative to the community and practices they're in. And doggone it, I should know their price they're going to charge is my money. It's my money. Empower me. And the reason why is if you empower me, I will make better health care decisions. I will make them. I will realize that ultimately I own out of my pocketbook and out of my lifestyle, my decisions. But that's what you're doing here. And you've done it rather easily in an environment in Washington State where we are having a knockdown, drag-out political fight, where adult discussion has been totally abandoned. We're beginning to do what kids do really, really well, which is to pick sides and decide that who is going to be the person who can thump the chest the biggest and yell the biggest, but the losers are consumers and the residents of my state. So the reason why I like coming here is I love the innovation that you're doing and its depth and its breadth. You look at, what works. Do you need to take an aspirin every day? The literature says you do not need to take an aspirin every day. How do you avoid a heart attack? What is the best way to do that? Do not eat like Ron Sims. That's the best way. Right? Do a Mediterranean diet. Do your fish and a lot of your vegetables, which my wife put me on for the last 3 years. I didn't even eat kale until recently. I didn't used to eating kale. I invite my friend over, we're going to have a kale salad. Oh, God, Simpson's going to have a kale salad. I said, yeah, but it's out of the garden, so you eat it. But we know that there are things that you are doing in your public interface that are guiding people to making better healthcare decisions and lifestyle decisions. You're doing those. And you're saying, well, this is how we did it. It was easy. We brought people together. These are the tools we had. This was free. This is what we provided. And I'm going, you say it easily, because all Super Bowl winners do that. It was easy. I just knocked down the person in front of me. I caught the ball. I ran the ball. I had great coaching. But you are more than that. You are an exceptional coalition, and I hope that you remain an exceptional coalition. Because I learned in anthropology there's nothing more powerful than the transmission of an idea. A really great idea. You're in a league of your own. And the issue, I think, in this country, what we're faced with, and several things in the future, there was a group of us that they gathered to think about, I don't know, somebody evidently profiled us and said, these people don't mind large amounts of data. I guess, because that's all we ever did for this meeting. We'd get together and they would give us these problem statements and data, and we would come out with data and say what was going to happen in the future. So you look at healthcare, what is the biggest significant issue in healthcare? The issue is, can we maintain the systems under the Affordable Care Act and the health insurance that we have today? And the answer is no, we cannot. You cannot take an industry, that's what healthcare is, and say, here's its cost growth without there having to be trade-offs. And people do not want to make those trade-offs in the long run. You can't say, this is the cost of healthcare, and so therefore lower your own standard and quality of life. You can't say we have to pay for healthcare, and therefore we can't pay for education and other needs. You can't say we need to pay for healthcare, we're not going to be able to have parts. You can't make that trade-off. And in the end, we call it the bulge. The bulge is so big that's coming up the pipeline that if we don't control costs, we'll go to a period of ill affordability. And that means that we're simply going to have people doing what they did. They will hide, they will not get their health insurance, and they finally get it. If they get it under Medicaid or they get it under Medicare, it'll be such an enormous cost that will be another, we call it a cost wall. And so the fact is that we are at a critical stage, not only being able to be innovative, but we're at a critical stage where we must be innovative. We must understand that we cannot afford the cost growth that we now see. But the work that you're doing in empowering consumers to make an ability to make a cost-based decision, the ability to look at how we're structured. I love integrated medicine. I do. I sit on a board of regents at WSU, and we are moving forward with that in regards to medical school, where we're saying no more hospitalizations, let's put people in community-based clinics. But we're finding out and report under the ACA the ability to extend medical care to larger segments in the state of Washington. We call them rates of 1 to 10,000. How many? We have 2 counties in the state of Washington with no nurses or doctors in them. None. 0. I mean, 0 presence. It's called get sick and die. And the others We have counties where the rates are lower than we call the South. We take a great deal of pride in our state of being able to say, well, we're the state of Microsoft and Amazon and Starbucks and wow, we're in a whole earth stops where we are. And then we have counties who's having doctors and nurses are at less than those in the impoverished areas of the southern United States. And so we realize that we are developing a new community-based system. That is, in the Affordable Care Act, you can have a central system that churns a lot of money, but they need to distribute those services to other areas, and that's what you're doing. The challenge we have there is how do you control the cost of that? So do you try to cover the cost of, for instance, a tertiary care provider who would build out a huge complex and build it out in a day and age when all of a sudden they didn't, when everybody was going to the hospitals and we had cost of difference? Or do you deal with that cost and how do you expand? The issue is cost control. Are there going to be cost increases in healthcare? The answer is yes. But I know you're already wrestling with that issue here in Maine. So a lot of people are going to watch how you figure it out. Is there hope? Can we control costs of integrated systems? If we can and you figure it out, we'll take your idea. We'll steal it and claim it, but we will actually put a little mark and say, from Maine. But nonetheless, you are dealing with issues that no one else is dealing with. You're going to have speakers today, you're going to have sessions today that are talking about issues that are unheard of and undiscussed in other areas of which nobody has a solution to it. No one does, trust me. I'll look at your agenda saying, oh God, I got to export this. But if I went back to the state of Washington where the people said, we're not ready for this yet, but you're ready in Maine. Good ideas have the power of making change. You're no longer fighting for the residents of Maine. Your discussions no longer are limited to Maine. Trust me, you're talking about what is going to happen in healthcare in the rest of the United States. Because somebody has to be first, somebody has to have the guts first, somebody has to have the idea first, and somebody has to have the solution first. And you raised your hand and said, we'll be first. So I want you to succeed. Because I have two very perfect grandchildren. I have a perfect granddaughter. She's 11 and she is perfect. When my son, when she comes in the house and she says, Grandpapa, I love you, all I know how to do is say, yes, whatever you want. When my son protested, he said, did you actually give her ice cream and cake at breakfast? I said, yes, I did. He said, why did you do that? I said, because she asked me for it. He said, well, you never let us do that. I said, I'm not raising her. Then I have a son, new son, grandson, and he's two months old. I want their world to be better than mine. This is simple. I want their world to be better than mine. I want them to live in a healthy world where their neighborhood generates health. I want them to be able to go to fine institutions. I want them to have this incredible new research on genetics so that they can take those tests and figure out what signs they have to worry about early, what signs they have to worry about late. I want them to be able to feel comfortable in a new healthcare world that you are birthing in me. That you are birthing in Maine. So it's not a promise that you made to your citizens of Maine. You are holding the keys to the promises that many of us are going to make to our own children and our grandchildren and their great-grandchildren. Now, I don't want you to say, oh, wow, that's unfair. But you volunteered to do it. Don't complain about what you volunteered to do. Nobody told you to do that. You simply said that we are in Maine and we do things differently in Maine. We do things differently. I used to coach kids in football. And when I went out in the field, we were 71-1 over 6 years, but we had one game, a championship game, that we were about to lose. And I remember they'd go on the field and the kids were crying, Coach, Coach, Coach. I said, whoa, gentlemen. I said to the center of the first touch, I don't want good vibes. When the quarterback says, hike the ball. I said to the quarterback, it would be nice if you just ran the play I call from the sidelines. Sometime today, maybe on the next play. Then I said to to the running back. Does any of you know where the 3-hole is? Because it's been open all day. And this guy Fred says, I know where it is, Mr. Cook. I know where it is. I said, Fred, 3-hole, 33, 3-holes, been open all day. And I said to one of the linemen, does anybody here know how to block the person in front of them? And Brian, the guy with the naval academy, raised his hand. I know, Mr. Cook. I said, okay, you know, Ron, Brian, Fred run behind them, 33, first hut. Boom, hit the ball on the first hut. I was so happy. I was happier for that than anything else. The quarterback actually turned and gave the ball to Fred. Fred ran behind Brian. Brian hit everything. Other players, officials, parents. We scored and won. Teamwork. Teamwork. Because even in places where we have a lot of good ideas, it's incredibly important to have teamwork. And so I always say that Washington Health Alliance works because we've decided that teamwork is our essence. It doesn't mean that we do not have our differences, but it means when the play is called, we're all trying to be on the same page and do our roles. Somebody hikes, somebody calls the play, somebody's running, and somebody blocks. And that's what you are as a coalition, where everybody is important and everybody is absolutely essential. Absolutely essential. So I look at all of you and I say, wow, I have great hope. I really do. When I sit to people, I say, what are you going to tell them when you get there? And I say to them, I got to tell them how good they are. Because if you are good, then my state can be better. Yeah, somebody in front is knocking down all the players and all the problems. It allows other people to come behind you and fashion solutions as well. And we can have a vibrant approach in this country to providing health care for people. So I really hope that you will take the mantle and run incredibly well with it. Yes, healthcare has a lot of issues in it. It really does. But who wishes to wake up in the morning and say, oh, geez, I want a dull day? You don't get a life to live a dull day. You get a life that allows you to strike forward and to make change. I look at my life and my parents, coming from, I said to my dad, Mom, how did you end up in Spokane? I mean, you grew up in New York City. How do you go from New York City to Spokane? My mother used to tell my father every anniversary, James, when are we going to go back to civilization? And he would say, next year, next year, next year. The previous 6 years was always next year. When I look at what they did, that was remarkable. We had no civil rights laws in my community. None. No open housing, no lack of job discrimination. It was all of a sudden that you were here, we wish you would go away. And my father and mother said no. So all I know, they began to organize with like-minded people. And I remember, we used to be called something named that I didn't know. My last name was Sims. I was sent home from school to tell my parents to behave. I remember saying that, Mom, Dad, my teacher wants you to behave. My father and my mother said, toots, time for the demonstration. So nonetheless, they organized and aspired for something that seemingly was intangible, something that was impossible, something that you couldn't pull. I didn't even understand what the issue was. I didn't even realize. I can remember sometimes at Calvary Baptist Church when the church would get up, Mrs. Maps made the best fried chicken ever known to humankind. And her sister, Mrs. Kirtley, yam pie, pound bread, apple pie, custard pie. Only angels made pie and cakes that tasted that good. But they would get up and they would sing a song in a cappella. Because there were some times where the depth of concern, and we always knew when they sang the song that something was on the minds of people that could be expressed in no other way. And it was a song that is a tradition within many of the African American churches. And I won't sing it to you because I was in a choir, mass choir once, and my dad stopped the mass choir, pointed to me and said, "Bud, lip sync." I was always annoyed by my pretty twin brother who had perfect tone. I did not. But the lyrics were simple. It said, I am no ways tired. I have come too far from where I started from. Nobody told me that the road would be easy, but I don't believe you brought me this far to leave me. And from that song, as the church rocked back and forth, you could feel this emanation of power and support and refreshment. And they would go out one more time. So I looked at the possibility of people going from New York City to an early Spokane, to the Spokane that I, by high school, saw, which had laws that prohibited discrimination in employment, laws that prohibited discrimination in housing, laws that began to affect school policy so that we could aspire to be greater than ourselves. We went from hopelessness to hope because a group of people in my community made a decision that everybody was going to be treated with fairness and equity. I remember going over to Seattle, Washington, which was a big thrill for us. And it was the Space Needle, which was so cool, because Spokane's tallest buildings were 6 stories tall, and we thought that was a skyscraper. And we got to Seattle, and there was a man named Samuel Barry McKinney, who was a new minister. Reverend Dr. Samuel B. McKinney. And I remember going to the Mount Zion Church, and all of a sudden there were these thousands and thousands and thousands of people. And he led them down and took on Seattle, who didn't believe that African Americans should aspire to be in office, could not be doctors, could not be teachers, could not be lawyers. And his persistence and his magnificence and what he did as a minister, what he did in terms of incredible intellect, a Morehouse grad, Rochester Colgate, amazing figure, brilliant in so many ways, altered the entire face of the city of Seattle and its politics. Later on, there was a New York Times article. For the first time in American history, Gary Locke, Asian, was governor. I was the county executive, and Norm Rice was the mayor. The first time in United States history where 3 people of color held the top 3 offices in any state in the Union. All because one person made a decision in the Seattle area, Reverend Dr. Samuel McKinney, that the status quo would not be maintained. So I look at all of you, and I say, you have no idea how formidable you are. You have no idea how formidable you are. You have none. You say, well, we just do this work and it's hard. We have our arguments. Well, I do too. My family argues with me all the time, and I always lose. But well, that's okay. I love them nonetheless, most of the time. Nonetheless, you're going to have your differences. But if you have everybody agreed all the time on everything, I'd worry about you. Because they would tell me that there's no innovation, and there's no imagination, and there are not differing perspectives. But as a group, you are unstoppable. As a group, you are unstoppable. And I'm asking you as a HBE chair in the state of Washington, I'm asking you because healthcare is on the minds of a lot of places and a lot of states, that it has to work here because you're the cauldron. You chose it. You wanted the role. You wanted to be it. You wanted to make the change. And yes, we will follow. If you say to us, can you rally around us? The answer is, you go ahead and fight the battle. That's okay, because we'll be right behind you. We'll watch your back. The answer is no, we're not going to watch your back. We're going to be incapable of moving with you because you will teach us how to make the effective fights, the effective policies, and to be able to move forward and make marked change. Healthcare has to work in this country. It has to work, and it has to be less costly than it is today, but it has to work. Everybody's entitled to health care. Everybody is. Nobody's going to be left on the road anymore. No one's going to be left on the road anymore. They're going to be welcome in every medical office. They're going to be cared for in every medical office. We're not going to have people who all of a sudden have to hide their illness, that they're going to be welcome for care and treatment. That we're going to make sure that they're treated as whole persons and valued persons, no matter who they are, what language they speak, and where they're from. Because we're going to take the spirit that you created, we're going to take the spirit that you created, and we're going to make it ours as well. In closing, when I was in college, I was in love. Now, I know what love is now. I know what love is now. But the first time you ever fall in love, it is so sweet. It is so special. It is just so really stupid. I remember the first candlelight dinner. I had Smokey Robinson on my high-five stick. I had two things struggling to be candles. Young lady I was in love with, she made a meal and we got to the pound cake. I love pound cake. So I took that piece of pound cake and she said, I forgot the sugar. I said, oh, you're all the sugar this man will ever. I followed her to Seattle, and as life does, life shows up. I saw her years later, and I'll never forget talking to her and laughing and smiling and just talking about her career as a teacher and a principal and administrator, and my career as an elected official. Just laughed and giggled and just acted stupid. I remember when we were partying, I turned around and looked at her, just looked at her. She was laying there very quietly. And I knew I didn't want to move. I knew this would be the last time. I just didn't want to move. So I just stood there. I stood there, oblivious to everything around me, and just looked at her. So she woke out of her very drowsy sleep, and she waved me over to her bed. And I said to myself, take a step, but be strong. And I said to myself, be strong, be strong, be strong. And my second step, I didn't care. And I got to her bedside, and I cried like a little boy. And she just held me and let me cry. But she said something that I would never, ever forget. She said, my job is done and my life has come to its end, but you have so much to do. So I would tell all of you that a higher authority than anybody in this room has determined your job is not done, because there's so much to do. So on behalf of all the non-residents of the United States outside of Maine, I am hoping you will be extraordinary. I am hoping you will be extraordinary so that our children will have a better life and we'll have the grandest healthcare system in the world. Peace to you and prosperity. Thank you.
Next year, I have to top this, and it's going to be hard. You know, the speakers that we've had in the past as keynotes, one was a New York Times bestseller, another was the former CEO of Alcoa and the former Secretary of the Treasury. Last year, we had the man who was the inspiration for the Dos Equis ad, and then now we have you. No more symposiums, I can't top this. Thank you so much, because I think what was so wonderful about your speech is to remind us of the power that we have, the power to leave a legacy, not only here in Maine, but for the rest of the country, and to make our lives better, and our families' lives better, and other people's lives better. So thank you so much for reminding me.